In this video, we will discuss the Coombs test, and before discussing the Coombs test, it is very important to understand the concept of the autoantibody. So this is an RBC, and on the surface of the RBC there are lots of antigens. For example, the ABO blood grouping antigens, the RH antigens, and many others. And in some conditions of the body, for example the immunohemolytic anemias, the body produces certain types of antibodies which are directed against these antigens. And these antibodies attach to these antigens and cause immune-mediated destruction of the RBCs and lead to anemias. And this antibody is known as the autoantibody. And the Coombs test is a test which is done to detect these types of antibodies. So there are two types of Coombs test, the direct type and the indirect type. And the common thing in both of them is the Coombs reagent. And it is very important to understand the Coombs reagent, how it is made, what is it, to understand the basics of the Coombs test. So let's first understand how is the Coombs reagent made. Please excuse me for my drawings, but let's suppose this is a human, and the body of this human contains lots of these autoantibodies. So what we do is we take the blood from this human and we separate the serum from this blood, which contains all of these autoantibodies. And what we do next is that we inject this serum into an animal. Please don't ask me what type of animal is this, it just is. Now the immune system of this animal recognizes these antibodies as foreign and produces its own antibodies against these. And what we do next is we take the blood of that animal and separate those antibodies which the animal has just produced against these autoantibodies. And we harvest those antibodies, and this is the Coombs reagent. So the Coombs reagent is nothing but the antibodies which the body of the animal has produced against these autoantibodies. Let's first talk about the direct Coombs test. And out of the two types of the Coombs test, this is the one which is used to detect the immunohemolytic anemias. So let's suppose this is a human which has immunohemolytic anemia, and his blood contains autoantibodies which are directed against his RBCs. So what we do is we take the blood sample from this patient and we put that blood into a test tube or a beaker. So here are the RBCs which are present in the blood of this patient, and here are those antibodies which are attached to the RBC surface. And to keep things simple, for the rest of the video I will refer to these autoantibodies as blue antibodies and the antibodies which are present in the Coombs reagent as green antibodies. What we do next is we add the Coombs reagent which has these anti-autoantibodies or the green antibodies into this blood sample. Now since these green antibodies are directed against these blue antibodies, when they react, they cause the attachment of these blue antibodies. And since in turn these blue antibodies are bound to the RBCs, it forms an agglutinated mass of the RBCs at the bottom of the test tube or the beaker. So here is the agglutinated mass of the RBCs, and this is a visible reaction which confirms the presence of autoantibodies in the blood sample. And one of the very important conditions in which the direct Coombs test is done is the hemolytic disease of the newborn, which is also a type of immunohemolytic anemia. Now let's talk about the indirect type of the Coombs test. And this test is mainly done for the prenatal screening of females for detection of RH antibodies. Sorry, this is a writing mistake. This is antibody, not antigen. Now let's suppose this is a pregnant female, and again, excuse me for my fantastic drawings, and let's suppose this is a fetus inside her womb. The female is RH negative and the fetus is RH positive. So what happens is sometimes at the time of the parturition, the fetal blood comes in contact with the maternal blood, and the maternal blood develops anti-RH antibodies against those RBCs. And during the second pregnancy, if the fetus is again an RH positive human, the antibodies these cross the placenta and destroy those fetal RBCs. So it is very important to detect those antibodies. So what we do is we take the blood from the female, and after some procedures like washing and centrifugation, we separate the serum from the blood and we add the serum into a test tube, same as that of before. And here lies those antibodies, the anti-Rh antibodies. Now here is the essential step which is different from that of the direct type of the Coombs test. Now since the maternal blood does not contain those RBCs to which these anti-Rh antibodies will bind, so we will have to introduce externally the Rh positive blood. So the next step will be addition of Rh positive RBCs either of the animal type or the human type into this sample. So again these antibodies will bind to these Rh positive RBCs. And the next step in this are the same as that of the direct type of the Coombs test. So when we add the Coombs reagent into this sample, these antibodies again bind to these anti-Rh antibodies and cause the agglutination. So agglutinated mass of RBCs is formed at the bottom of the test tube. So this was all about the Coombs test. I hope you find this video informative. Make sure to hit the like button below, and also if you want more videos, don't forget to subscribe. Thank you so much for watching this video.